Hello, everyone. My name is Job Nyangena Nyameno. I'm a tutorial fellow at the Moi University Institute of Biomedical Informatics. And on screen below are my collaborators. I'm presenting today on the work on the development of harmonized benchmarks for the Master of Science in Health Informatics degree program for the East African region. So a quick overview of the presentation today. So we're going to have a background of our work, the methods we used, a presentation of the results, a discussion of the same, and conclusion at the end. And so for a quick background, over the past 2 decades, the East African region and indeed the world at large has experienced an increased demand for skilled digital health personnel. And this has led to the establishment of postgraduate degree programs in health informatics in the region. Unfortunately, the problem with these programs is that there's a wide variability in the courses offered and in the competencies covered. So this makes it difficult for employers to compare graduate quality because it's difficult to compare the degree programs. To this end, and to alleviate this problem, we decided to conduct a curriculum harmonization process whereby we set out to establish benchmarks for qualifications, program delivery, and certification. The idea is we want to standardize the competencies covered and the expected learning outcomes so that the graduate quality is comparable and the degree is also comparable and recognized across the region. It's important to note that harmonization is not the same as homogenization. We did not set out to make the curricula the same. We set out to have agreed common goals, objectives of the course, and key learning outcomes and competencies, such that it's possible to compare the degree programs and it's possible to have mobility of staff, that is faculty staff, students, and labor across the region. And the idea here being that institutions in the region will have the flexibility to contextualize the curriculum to their local context or setting. So the benchmarks just provide a guidance on what is expected of a graduate of the program, and everything else the university is flexible to modify for their setting. So the universities that were recruited were the ones that currently offer these masters in the region, and from the East African region, as shown in the screen. That's Moi University and University of Kenyatta University in Kenya. In Tanzania, we had Muhimbili and the University of Dar es Salaam. In Ethiopia, we had Mekelle University and University of Gondar. And in Rwanda, we had the University of Rwanda. And on the right are the accreditation bodies and commissions for these different jurisdictions. Before we started, as part of the preparation for developing these benchmarks, we did a comparative analysis of the different postgraduate health informatics degree programs offered by these universities. And as you can see on the screen, there's a wide variability even in the units and the credits offered. That's on the right there. And we also did a comparative analysis in the sense that, as you can see in the chart on the screen, on the x-axis, we have the university that numbered 1 to 7. And on the y-axis, we have the competencies as recommended by the International Medical Informatics Association. And so the courses offered by these universities ranged from 8 to 22. It's important to note that in the chart, the black squares are the competencies recommended by IMEA that are offered by the university, and in white are the competencies that are recommended by IMEA but are not offered by the university. And as you can see, the competency coverage by programs ranged from 62% to 97%. And there's a statistically significant difference in the competency covered across these 7 evaluated curricula. We also did a pairwise comparison where we compared the curricula of the different universities, and we are comparing, how many courses offered by these universities overlap. And of the 21 pairs, only 4 met the cutoff of 70% similarity. That is 70% of the courses offered are similar. And this 70% cutoff is the one that tells you that these degrees are comparable. As you can see, most of the degrees are not comparable because they're less than that cutoff. And this difference in program affects the mobility of students across the region if one wants to transfer their credits. It affects the mobility of faculty, also affects the mobility of labor, and makes it difficult for employers to even compare graduate quality. And this makes the case for conducting curriculum harmonization. And so for the methods, the setting was the East African community, which is composed of the countries shown on the screen. That's South Sudan, Kenya, Uganda, Tanzania, Burundi, and Rwanda. Ethiopia is not a member, but was an observer in the exercise. And so we did this under the auspices of the Inter-University Council for East Africa, IUCEA, which is the strategic institution for the East African community that is tasked with the development, coordination of higher research, higher education and research in the East African community. And so in 2006, the IUCEA started a harmonization process where it wanted to harmonize all curricula offered by higher education institutions in the region, and it created to create an East African community quality assurance framework for higher education. And so it also aims at setting regional higher education benchmark quality standards, and that this is based on internationally recognized frameworks. So the whole objective, or rather the objectives for these benchmarks, as I said, were really to standardize degree programs in health informatics, postgraduate degree programs in health informatics in the region. And this is to, as shown on the screen, specifically to guide as a tool for universities to design their own curriculums, to enable national commissions to conduct audits and to assess the quality of these programs, to promote harmonization, to support staff and student mobility as discussed, and to enhance regionalization of the labor market, which is one of the goals of the East African community. And so the process itself, once we identified the universities that offers this program, we invited them to participate in the exercise. And then based on the IMEA recommended competencies, we developed the draft benchmarks, of course, in collaboration with all these universities. And then we shared this with the university stakeholders, with the institutional heads and other stakeholders, ministries of health, private sector. And then we had a workshop where all the stakeholders came. This was in Nairobi. And we discussed and came up with a final draft of the benchmarks for this degree program. And then these benchmarks were forwarded to the IUCEA for final review and approval, which they did. And so they approved and endorsed these benchmarks, and now they can be used by universities in the region to develop their own programs. And so I'm going to run through the results. Basically, what are these benchmarks that we came up with? And on screen is the overview of how we're going to present this, from program goals to the graduation requirements. So the program goals and objectives for each of these programs should be to enhance students' learning and mobility, to produce quality graduates and improve students' learning retention and completion. Of course, increase students' employability, and to provide guidance to instructors to identify and overcome barriers to teaching. And one of the key things that we developed in these benchmarks were the expected learning outcomes. This is what we expect a graduate to know at the end, or rather whatever they should have learned by the end of the program. This was divided or rather categorized according to the key knowledge, skills, and attitude framework. So whereby, they gain knowledge on the discipline, that's health informatics, understanding the principles and demonstrating the application. They should have skills, and the skills are cognitive, that is to be able to evaluate health information systems, processes to improve healthcare, analyze data, practical skills, and interpersonal skills. And then, attitudes, which are the values that they develop as part of the training. And this is, ethics, integrity, leadership, and other behavioral factors that allow someone to be a professional in the field. And so the benchmark themselves, for the admission criteria, the background should be a bachelor or a postgraduate diploma in health, in a health-related course or in information sciences, or a bachelor's degree with a pass from other fields if they have significant work experience in the proposed area of study. This significant work experience should be determined by the university itself. So the length of full-time program should be 2 years, while a part-time should be 4 years. And the structure is going to be discussed in the next slide. So we have crossover subject areas where students with a health background will do IT courses, and students with an IT background will do health-related courses. So this is also foundational phase where they're introduced to the field. And then the core subject areas are now health informatics proper courses. And as shown on the screen from number 1 to 12 in the middle section of the table, that's foundation of health informatics all the way to health data analytics, biostatistics, and a research component, thesis, and a practical experience. And then we have the elective subjects, which are they're health informatics related subjects, but really the university can decide what to put there. And whatever we have on screen is just an example from public health informatics, security in health systems, imaging informatics, and clinical informatics. So for students to graduate, they should successfully complete the taught courses as shown in the previous slide, an attachment, research project and thesis according to the university's regulation. So the attachment is a practical experience. And so this was a collaborative effort by East African universities and the Inter-University Council for East Africa to develop benchmarks for health informatics postgraduate training. And to our knowledge, it's the first demonstration of a credit accumulation transfer effort in health informatics within the low and middle income countries. The whole purpose of this was to facilitate comparability, compatibility, and mutual recognition of postgraduate health informatics degree programs in the region, allowing us to employers and graduates and staff to move freely within the region. It will also support the quality assurance of Masters of Health Informatics programs. And so they'll serve as a reference for any new program. Again, it's important to note that harmonization is not homogenization, and universities are encouraged to modify the curricula to their local context, as long as the expected learning outcomes and competencies covered are not tampered with. And it will be reviewed every 5 years according to IUCA guidelines. And so the benchmarks are a significant step towards the standardization of quality training in digital health in the region. And regional universities are encouraged to update their curricula to align with the benchmarks. And so they can update them, modify them to their context, as long as the competencies covered are still covered. The universities can deliver the content in whatever way they feel fit or whatever works for them. And so we want to thank the United States Agency for International Development, the Norwegian Agency for Development Cooperation, that's NORAD, for their funding of the project activities. We want to thank IUCA, that's the Inter-University Council for East Africa, for collaborating with us and facilitating the process. We want to thank the Health Informatics in Africa Association. We want to thank the Commission for University of Education in Kenya, the Ministry of Health Kenya, and all the participating universities, the private sector collaborators, and all other stakeholders. Thank you very much.